So, good morning, good afternoon, and good evening to all of you joining us today. My name is Ashni Moodley. I'm the theme lead for antimicrobial resistance at the International Livestock Research Institute, and I'm a joint appointee with the University of Copenhagen. And I'm joining you today from Copenhagen, so lovely autumn weather we're having. I'm delighted to be your facilitator for today's session. It's the first webinar in our ORECA closeout series, and it's titled Community Engagement and Behavior Change in One Health. But before we begin, I'd like to welcome Bernard Bett, who's the lead for ORECA, to welcome you and to give you a few words about what ORECA is. So Bernard, over to you.
Great, Ashni. Yeah, lovely to see all of you joining. We are really happy to host this webinar today. So good morning, good afternoon, good evening, wherever you're joining us from. And basically to emphasize what Ashni has said, this webinar is being hosted by the One Health Center in Africa project, which is funded by BMZ. The project commenced in 2020 and it's meant to end in December 2025, a few months away. And actually, we are hosting this webinar as part of our closeout activities. And as Ashni says, we have 3 more such webinars coming up in the next 2 months. We'll have one on One Health capacity strengthening that will be done on 27th of October. We have another one on climate and health that will come up on 7th of November. And the last one, which actually is really kind of catchy, it will be impact of ORECA. And we really hope that, most of you can join to hear what we have managed to really influence over the last 5 years in which the project has been running. So I really don't have much to speak about today, but to emphasize that, ORECA was designed earlier on to focus on 2 main areas. One is applied research to help us design solutions, innovations, which can then help in addressing key One Health challenges, which we classified into 4 areas, which I think we'll be discussing as we go along. And the second objective, which also is quite interesting, is look at capacity strengthening and how do we influence both the capacity to implement One Health as well as generate or develop new policies with decision makers to influence their allocations, their capacities to control some of the diseases, the health challenges that we are addressing over that time. So without really taking much of your time, I think I want to hand over to Ashni and just to emphasize that we are really very excited to have you joining us for this webinar. Over to you, Ashni.
Thank you very much, Bernard. As Bernard said, it's a 5-year project. And as we close out this important chapter at ILRI, we wanted to reflect on one of the most important lessons that we've learned in our journey, that sustainable change starts with people. And so today's conversation is going to explore how meaningful engagement with communities can drive sustained behavioral change beyond a project's life. So let's start by hearing from 2 of my colleagues who bring complementary perspectives on community engagement. So I'd like to first invite Geoffrey Njenga, who's ILRI's One Health Communication Officer and was also the communication officer on this particular project, to share his reflections. So Geoffrey, over to you.
Thank you, Ashini. Let me just share slides. Let me know if you're able to see.
Can you swap to the other screen display?
Is that okay?
Perfect. Perfect. Thanks, Geoffrey.
Great. So let me start by introducing myself. So good morning and good afternoon and good evening from wherever you're joining us. So my name is Geoffrey Njenga, Communication Specialist with the One Health Center in Africa, led by ILRI. I work at the intersection of science and storytelling, helping turn complex research into real action with the communities we work with. So today I'll share my reflections from our community engagement journey across Africa. It's a look at what I've learned, what works, what doesn't, and how communication can turn awareness into sustained behavior change. So for me, communication is not about messages, it's about relationships. we create with the communities that we work with. So yeah, so information doesn't change behavior, trust does. So this quote captures the essence of what I've learned in this work across Africa. We face interconnected challenges, zoonotic diseases, food safety risks, and antimicrobial resistance that affect both people and animals, and ultimately the environment we depend on. Yet at the center of all this, we have people, we have farmers deciding how to treat sick animals, herders, mothers deciding what to give their children, and the youth whose daily choices shape the health outcomes more than any policy or campaign. So in my reflections today, I'll just share experiences from Kenya, Malawi, Burkina Faso, what has worked, what hasn't, and how communication, when rooted in trust, can turn awareness into sustained behavior change. So then, why does engagement matter? So behavior change doesn't start with information. It starts with context. People act when messages fit their daily realities and lives, and when they trust the source. So in One Health, the link between human, animal, and environmental health is a complex one. But the real challenge isn't the lack of data, it's participation. So for me, engagement turns communities from recipients of information into partners in prevention and change. So think of it as think of the change as a journey. So it doesn't happen in a straight line. People move through stages, and my role as a communicator is to work with them. So if you look at this graphic down there, for me, it starts with awareness. This is where people first hear a message. Maybe it's a radio spot about rabies or a community meeting on antibiotic use. The awareness plants the seed, but it's just information on its own. It rarely changes behavior. And then the next is attitude. When people start to see why it matters, they begin connecting it to their own lives. Am I doing this to protect my children, my livestock, my food? Here is where the stories and trusted messengers like community health promoters make the science personal. And then we have the agency. So this is turning point. So this is the turning point. This is when people feel capable of acting. It's no longer just, someone should do something, but it's, I can do something. And this is built through, trust, inclusion, and the small wins, like co-creating a poster, for example, or training a local champion. That's the heartbeat of behavior change. And then lastly, after agency is action. So you get people to actually do something. So you get people to come and vaccinate a dog, wash their hands before eating, or stop misusing antibiotics. And this is where engagement becomes visible, where words turn actually into practice. And then finally, there's adoption. This is when new behavior becomes normal, part of the community culture. And people are able to remind each other, that's just what we do here in this community. And then I'm just going to walk you through, wait. So I'm just going to walk you through, sorry. The slides are misbehaving. So I'm going to walk you through, some of the examples that we have. And, here we're looking at Machakos County, and this is a county in Kenya. So this is we're doing a rabies vaccination campaign, and as you know, rabies is a fatal but preventable disease. And like many places, awareness wasn't the issue here. The challenge was motivation to get people to get their dogs vaccinated. So instead of creating messages, in our offices here in Nairobi, we invited the community to design them with us. And we got dog owners, we got local leaders, veterinarians who came together in workshops to draw, to discuss, and to write messages in their own words. And this workshop was done in the local language so that they could fully engage. And one of the things that they told us is dogs are not just for protection, they are companions, part of the household. And that insight, a dog that isn't your friend can't protect you, completely reframed our approach. So we stopped talking about rabies as a threat, and started talking about caring for your friend. So that language and the colors and even the imagery came from the people themselves. And as you can see there, you have the drawings that they drew themselves. And here we have the final posters that they came up with. And the materials were co-created and now they are being used, and the community began to see vaccination as a shared responsibility, not a government exercise. And based on the graphic that I'd shown earlier, and that's agency in action. People moving from awareness to ownership because they trust the message and they see themselves in it. And the other thing is in Kenya and Malawi, one of the things that we did was to train local champions for One Health. And sustained change needs more than one campaign. It needs a local voice, people whom the community already trust. That's where our community champions come in. And in Kenya, in Isiolo County and across the various districts in Malawi, we trained over 60 trainers and over 200 community champions. And this included chiefs, women leaders, others, youth representatives, and even religious figures. And these sessions were all in local languages, full of relatable examples. We didn't stop at face-to-face training. We also set up WhatsApp groups, linking, the vets and the health officers and community reporters. So, for example, in Kenya last year, when there was an RVF outbreak, the WhatsApp groups were able to spread the information in minutes. And this was proof that engagement doesn't end when the meeting closes. And these champions became the bridge between science and society. So they led local sensitization sessions, corrected myths, and mobilized their own neighbors to be able to, to be the change that they needed to see in the community. And because the message came from their own people, adoption was faster and more lasting. So, so what works in sustaining behavior change? So listen before designing. So everything starts with listening. So when communities define the problem, solutions stick. So for example, in Machakos, our first step wasn't designing posters. It was asking people what dogs mean to them. That listening built trust before a single message was drafted. And then the other thing is co-create and test with users. So co-creation turns audiences into authors. So when people see their language and ideas reflected, they take ownership of the outcome. And then use trusted voices and visuals. So behavior change depends on who delivers the message. So a chief, a mother, a local vet often carries more influence than an external expert. So, and visual tools in local languages amplify that trust. So if you can look at that picture, you see all those messages are in Chichewa, which is the local language in Malawi. And then, blend emotion and evidence. So facts, they open minds, but stories, they open the heart. So when we paired data with emotion, like, linking vaccination of dogs to friendship or health to family safety, messages resonated deeper and, lasted longer. And then the last one there is the reinforced messages consistently. So change happens through repetition, follow-up visits, WhatsApp reminders, continued dialogue, and this sustained communication builds habit, and habits build culture. So what doesn't work in sustaining behavior change? So we've seen what works, but it's equally important to recognize that what doesn't. And these are some of the pitfalls that we've all faced. And, they explain why some well-intended projects don't stick. So one of the things is top-down jargon heavy messaging. So technical language, builds distance, not understanding, what the community actually needs are and what their language is. So when communication feels like instruction instead of dialogue, people tune out. And then the other one is one-off campaigns with no follow-up. So behavior change isn't a single event. So you can do a workshop and spark interest, but without reinforcement, reminders, feedback, and continued engagement, the momentum fades after the initial workshop. So Communities need constant dialogue, not a one-day outreach event. So ignoring gender and social norms. So this is something that I really learned when I was in the field. If women can't attend meetings or youth voices aren't heard, messages miss half the audience. And inclusion isn't an add-on. It determines whether behavior change becomes household practice or not. So it's important to include, women and young people, and even in places like Machakos, including the children who are mostly affected by the dog bites. So assuming the last one there is assuming awareness is action. So you'll find like many initiatives stop at information, but knowing the risk doesn't automatically lead to doing the right thing. What drives change is trust, belief, and the feeling that, my action matters. And that's why engagement must build on both understanding and confidence. So then we answer the question, how do we sustain behavior change? So we need to embed behavior change communication in design and budget. So, we should never be an afterthought. It needs to be built into project design with clear resources and accountability. We need to measure trust and ownership. So too often we measure awareness or attendance, but what really matters is trust. So do people believe in the message and own the message? Do they feel responsible for the outcome? So these are indicators that tell us if change is taking root or not. And then the other thing is build local content creators and champions. One of the things that I found out is that champions keep the momentum alive after the projects close. And even after, you exit in a particular community. But if you equip them with the tools, the stories, the digital skills, this turns them into ongoing communicators who keep the behavior change alive. And I saw this especially with the Isilo committee when we gave them the tools, the messages, and also the WhatsApp groups. And then we need to link counties, countries, and regions for peer learning. So peer learning multiplies impact faster than isolated efforts. So change becomes sustainable when communication becomes part of the system. So my closing reflection, across the communities I've worked with, one lesson keeps coming back. Behavior change doesn't start with messages. It starts with relationships. So when people are part of the designing the solution, they don't just receive change, they drive it. So from awareness to adoption, communication is the thread that holds the journey together. So it transforms information into trust into action, and action into culture. So as we continue with this One Health journey, let's remember lasting impact comes when we move from awareness to ownership. Because in the end, trust is our most powerful vaccine. And we need to continue engaging community so that we can be able to effect the change that we want to see. So those are my reflections. So thank you. And I look forward to hearing your reflections as well in the chat box. So let's engage. Thank you, Ashley. Over to you.
Thank you very much, Geoffrey, for those great insights. And I think I like some of the words that you were saying, talking about trust. Trust is incredibly important, as well as local storytelling can be the catalyst for change. And I particularly like the putting a face on data. As a scientist, that's sometimes really difficult to see a face to a number, perhaps. So thank you very much from that. Next, we'll hear from Birgit Habermann, who's a senior scientist here at ILRI, and who bridges scientific research and local practices. So Birgit, I know you're unwell, so thank you so much for joining us today. And looking forward, so the floor is yours.
Thank you. Sorry, I look and sound a bit terrible, and I'm not very well prepared. While you were talking, I was still pitching something together because I'm not sure that I'm good in free speaking today. So what I'm going to talk about, I think, relates very well to what Geoffrey has been saying just now, just with a slightly different approach. So I've been thinking a lot in my work about co-design, and that applies to animal health. It applies to feed and forage and genetics, everything we work on, adaptation to climate change. And it starts with, actually, I think it starts with ourselves. So the way we engage communities has to start with ourselves. We talk so much about behavior change, but we don't talk about our behavior change. We don't talk about the behavior change of delivery agents, development agents, the extension system, the researchers we engage with, NGOs, everyone in this huge business. But I really, after 25 years in this business, I have to say, if we don't change, nothing will ever change. And we're changing very, very slowly. So what does this graph tell us? There's all these different interests, this intersection, transdisciplinarity that influence how we engage with communities. And without knowing, we come in with so much baggage that we then impose on the people we work with. So we work with international partners of different backgrounds, then we meet national partners, then we try to find the right stakeholders in the food system or whatever boundary we put on the place we work. We bring in gender transformation, which is a huge concept, by the way, that very people really understand when you talk to them about it. We have to ensure social inclusion. We try to link global societal environmental goals with local political and societal research agendas, because, we often seem to assume that, but there is no blank slate in this world. Wherever we go, there's something going on, but we enter as if there's nothing. So that's why I have all these questions here. Do we really talk all about the same when we talk about the places we work in? For example, we've been working on emissions. Does anyone actually have data about emissions in the food system? Do you really have all the data you need to have in animal health? Where we're not supposed to scale technologies in our work, but whose technologies actually count? So there's a lot of questions between the actors and the actor networks that we bring in and the value systems that we carry with us. And then the realities on the ground. Do we really understand everything? Well, we pretend to, because we're the experts, right? Then we often talk about this facilitating innovation from the ground, the so-called ground, the people we work with. Sorry, I didn't have time to format this here properly. So there's all these technologies that we bring in, our concerns and the blame for people not managing the environment or health issues properly, political interests that come in, external research agendas, internal conventions, donor interests, very big one. We've been hit very badly by this today again, as many of you know. Value systems and norms. Whose value systems and norms are these really? Then there's these place-based actor networks that we very often forget about. So these are these assumptions that there's not enough infrastructure, resources, and capacities. People need training, so much training, right? And there's a lack of soft skills to engage with people in a participatory way. But who is really lacking this skill? Is it the people we work with, or is it us? It needs more, we assume it needs more awareness on environmental issues, gender transformation for behavioral change. But then we also have our internal assumption. As external actor networks, we believe that we are the ones who protect the rights of the so-called beneficiaries. We are representing the right value systems and norms, and we are the owners of advanced knowledge and technologies. So there are lots of questions about trust, respect, coloniality, sufficient understanding about the other. So coloniality is something we really should be more aware of. It's a set of attitudes, values, ways of knowing, and power structures that was upheld as normative by Western colonizing societies. It still continues. It's not the end of it. So it's in our everyday work, and we should be much more aware of it. And that is not just somebody coming from Europe to Africa. It can also happen in the same way if somebody from a town comes to the countryside, says something who is a very much countryside person, cannot imagine a place I grew up in, and what it does to us when somebody from the city comes and tries us to tell us how to live our lives and what to do. So then I noticed that, kind of in response to this criticism that is not new that I laid out just now, that a lot of people seem to feel the need to put in the codes, the co-design, the co-create, the co-develop, the co-innovation in a lot of our work. You see it all over the place. Of course, as someone working in the CGIAR, I had to run this through ChatGPT, the portfolio, and I saw that the highest frequency is in the term co-create, which is also a pretty vague one, but then you find also a lot about co-development, co-design, co-innovate. So it's something that seems to people seem to think a lot about how to actually engage people, or how to say that they're going to engage people. Because that's what it's all about, engagement and showing impact, right? But does it really help us? Not, I would really hardly argue it doesn't change anything as long as we're just using them as buzzwords. Buzzwords that signal inclusivity, empowerment, and local ownership because donors and policymakers ask for it, not because we know what we're doing. So the label co-design helps proposals get funded. The report sounds super progressive, even if the underlying practice has not changed. So there is a risk of conceptual dilution. It gets hollowed out. And at the end of the day, the people who work with are going to suffer for it. So it's not all gloom and doomy. We also have some solutions, at least we try. Let me just briefly tell you about the work that I've been doing. And I think it's a step in the right direction, but it's not perfect either, but at least we're trying. So we're using something that's called positive deviance theory. And really the core idea is that you try and find people in communities or communities as a whole who are succeeding better than others in the same circumstances. So what's really important here is to try and understand the uncommon practices. So let's say one community stands really out in how they're managing rabies control, to pick up on what you said earlier. Then you try and understand what is it in this community that's different from other communities. And you try and understand this. And if other communities say, well, this is actually valid, we could do that as well, then it can scale out. But what is important here to understand is that we as scientists have to take a step back, because this is community-led. It's really what people believe in, what they can do, and not what we think that they should be doing. And it seems to be harder than it sounds now. But this approach really matters because it empowers communities to drive their own change. In the long term, it's also cost-effective because the solutions come from within. And it's already used globally. You wouldn't believe how many cases there are, but few people in our business know about it, especially in health, actually in human health. And why does it work so well? There's a very famous example of child malnutrition in Vietnam that I was can share the link with you about that one. It works because it focuses on strengths and assets already present. And it promotes collaboration, local innovation, and it reduces dependency on external experts. So it promotes something people can believe in themselves, something they can try out themselves, and with resources they have at hand, which makes it much more attainable than things coming from the outside. We have tested this now in Ethiopia, Kenya, Uganda, and Colombia, and we really believe this is something that works. And we're determined to take it further if we're allowed to. This is also something that I want to emphasize to get back to what Geoffrey said earlier about behavior change. So very often, and this is also one of the reasons why I really believe this concept works, because it just resonates so much with how I'm thinking as a human being, not as a scientist, but as a human being. See, knowledge isn't static. We always talk about local and indigenous knowledge as something like, relatively valid, something a little bit historical, romantic. But in reality, that's not the case. If you look at the people around you, yes, we all have our own private knowledge. It's actually everyday knowledge and lived experiences. And that is what matters. And it can include local indigenous knowledge as we know it, but also includes modern knowledge. Nobody's disconnected from this world. But what does convince us? Are we getting convinced? Are we changing our attitude through knowledge? Usually we think that knowledge changes attitude and practice. That's what we have been taught for decades. But in our reality, in our life, what changes is practice. Practice changes is attitude and knowledge. If you think about it, if I come and tell you something that I've read in a fancy report or give you a scientific paper, that might not change your attitude about something. But if I can show you practically how this is done differently, then you might start thinking about it. That's just how we work as human beings. So this, I think, is really important that we try and understand that. This also is important for the way we work with communities. And the other thing, and that's pretty much the last point I want to make, we often talk about our usual beneficiaries as the target group, and under quotation mark, of course. That's the majority of people in the environments most of us work in. But actually, the technologies that we are promoting and thinking about as scientists are usually targeting the top of this pyramid, the people who are able to sustain adoption of technologies. But they are really on the top of the top, and they're not compatible with the majority any longer. Most people at the bottom of this pyramid are not able to sustain the adoption when the projects are finished. So they may come to the trainings, they may show buy-in while the project is ongoing, but afterwards, even if they wanted to, they can't sustain it. The people in the middle that we work with, those positive deviants, we call them adaptation pioneers, and we work with them because they have solutions that work in the long term for everyone. And that's why I believe it's just a more sustainable way of working and achieving change and transformation in the long term, because it comes from within and not from the outside. Just briefly, examples what we've done to empower people also in the research process: data collection by farmers themselves, and they get the data back, of course. We're not just draining it from the system. Field days held by pioneer farmers themselves. So except for me, the people in the green coats are all pioneer farmers, organizing the field days, demonstrating what they want to demonstrate on their farms to the people they want to invite. And they also produce these booklets. This one was in Ethiopia. We have a similar one for Kenya, where they're documenting their own practices and sharing it with others. Last slide. What you have to remember, co-design is a mindset. It's just how we work. What you said, what you did matters less for people, is how you made them feel. So how you do the processes of engagement reflects your attitude. It shows your awareness of the value of other people's knowledge. And it depends on your social skills also and your confidence in facilitating rather than leading. At the end of the day, it reveals your intentions. So this is extremely important when you engage with communities. It may sound very self-evident, but unfortunately it isn't. So happy to discuss further on this. This was it for today. I hope it met the expectations.
Thank you very much.
Contribution.
Thank you very much, Birgit. I knew it was really good to invite you because I think you were going to throw a lot of challenges at us and also challenging us as a scientist when we go into the field, the preconceptions that we come with, and that we are also needing to be open to change ourselves, and that can be very difficult. I will say that you were not presenting your slides.
Sorry, I just realized that I'm not quite myself today.
No, so perhaps if you could, if you're happy to put them in a PDF and pop it into the chat.
Yeah, I will do that. Yeah.
To do that. I did find your positive deviance paper for Ethiopia, which I've also added there. But I just want to say thank you so much. I think a lot of the things that you spoke about are some of the untold truths, maybe, that we don't necessarily talk often about and are critical of ourselves as we engage in these communities. So I want to just say thank you very much for that. And if you can hang around, if you're feeling up to it, then please do. And then you can also engage with some of the participants in the chat. Thanks a lot, Birgit. I hope you feel better soon.
Thank you.
So we'll move now to our main segment, which is an interactive fishbowl conversation. And I'm joined by an excellent group of panelists today who bring diverse experience in community engagement from different contexts and sectors. So please, Nani, Anthony, Martin, and Jess, can you please switch on your cameras? And I'll quickly just introduce you and we'll dive into the conversation. So Nani Mumba is from Kemri Wellcome Trust. Anthony, I'm so sorry, Anthony, I'm going to not do justice by your surname. Adhiambo from AMREF. Martin Barassa from VSF Germany, and Jess Mitchell from the University of Edinburgh. And thank you all for joining, for being here today. And for this next part, we'll do things, I'm hoping, a little bit differently in a rotating fishbowl discussion. So a lot more conversation than me asking you questions. But I'll start off with one question, which I heard Geoffrey say many times, but also Birgit in her intervention also mentioned it: trust. And in your experience, what builds trust fastest and what breaks it down. So I'd like to start off with you, Noni. Perhaps you could say a little bit more about the work that you're doing, and try to put some words on my question about trust building or what breaks it down the fastest. So Noni, you first, please.
All right. Thank you, Ashni, and hi, everyone. Just as Ashni has said, my name is Noni Mumba, and I work in Kenya, a coastal county called Kilifi. Very beautiful place. We work almost by the beach. I work here I've worked for Cambridge Welcome for 12 years now, managing community, public, and policy engagement aspects. And really, what that means is together with the team, we develop strategies, we develop approaches that enable our scientists to engage with the local communities, local stakeholders like the local county department of health, and other relevant local and national as well as regional stakeholders. Different approaches that we use, which I'll talk about as we continue the discussion. Trust, very interesting term. And when I speak, I'll be speaking from my experience in engaging for research, which is a little bit different from developing interventions and changing behavior, where you really want people to adopt, for example, behavior, adopt an intervention, adopt a tool. Ours is engagement for research. How can we build trust the fastest? I don't think personally there's such a concept as fast building of trust. You cultivate trust. And trust is cultivated over time. It's not an on and off switch that you can really build trust so quickly, and it can be broken very quickly. But building it really takes time. From our experience, and I think Geoffrey and Birgit has, both of them have already alluded to some of the things. You really want to begin with developing relationships. You want to develop genuine relationships with the community members. In our experience, for example, when we were developing our community engagement strategy, it was a co-development process. We held a consultative workshop where we brought together community members from the local areas where we draw study participants from, and where we also hold a quarterly census, a demographic census activity. So we brought together community members, we brought together researchers, and we brought together the local Department of Health into a consultative workshop where jointly all of us discussed, what have been the gaps, community members were able to share what are their concerns, what are their issues with our research work, with our scientists, what do they think we are doing wrong. And on our part as a research organization, we needed to be really open to take on the feedback, the criticism, and agree then jointly what then needs to happen. So that was one of the things that we did to build trust. I think the other way to build trust is to bring on board people. A bit of a difficult thing to do. So a lot of times, often we will find projects, bring on board community members, but at the periphery, sort of like what Birgit was saying. Like we are doing engagement, but we don't quite mean it. Like it's a tick box type of a thing. So one of the things that builds trust is also incorporating local people who community members trust. They feel like they are part and parcel. They are not at the periphery, and obviously also listening to their needs, listening to their input, and taking on board what you can take on board and what cannot be done, giving a genuine reason why you cannot implement what they are proposing or a recommendation that they're giving. So that can cultivate, and obviously you have to maintain that over time in terms of exercising openness and honesty in what it is that you're doing and being open to feedback and input from community members. How can trust be broken? Again, I'll share from our experience as a research institution. Trust can be broken when, as a project, for example, you are not speaking in one voice. So as a project, when you're together with community members, you're saying one thing. When one project staff goes off on their own and they meet a couple of stakeholders, community members, they say something different. We have had that experience, that feedback from some of our communities where they say, we meet your staff in the population, we ask them about a certain study, and they say they don't know anything about that study. So already, community members feel like, hang on, you work for that organization and you don't know what they're doing. So that, trust can be hurt, where people feel like members of the project don't know what is happening in that project. Trust can also be broken if something drastic happens. For us who are dealing with research, when we are carrying out clinical trials or any other clinical research, maybe you're trialing out an investigative product and a study participant dies. Maybe not as a result of the interventional product, but they have been recruited into a study, they've been in a study for about 2 months, and then they die. So often we find those kinds of things break trust. When you go back to that village, people don't want to see you. They don't want to hear anything about research. Now you have to start building again that trust. So those are some of the things in our experience that have broken trust, and some of the things we've done to cultivate trust over time.
Thank you very much, Nani. So I think you said a lot of great things about, cultivation, and that I like that you see yourself as the bridge between the community and the scientists at KEMRI Wellcome Trust. So it's good to have a translator between us sometimes. But also I like that the bravery to want to know about what we're doing wrong, and then to get that kind of feedback, and then seeing how then do we reflect as an institution to better serve the communities that we're working with. So I really like that resonates. And I wondered if Jess or Anthony, Martin, coming from the work that you're doing, and sort of reflecting on what Nani said, that the approaches that KEMRI is using, does that resonate with you? Anthony, I see you've come off, and Martin, so we'll go Anthony, Martin, and Jess.
All right. Thank you very much, Ashley, and good evening, good morning, good afternoon, everyone. My name's, I saw you had a problem pronouncing my name, Ashley. My name is Diambo Anthony, and I work for AMREF Health Africa in Kenya, based in Kenya. Well, what we do as AMREF, we are implementing a project known as One Health for Heal, One Health for Human, Environment, Animals, and Livelihood. And this is a regional project that we do implement in Kenya, Ethiopia, and Somalia, just at the triangle. And the areas that this project is being implemented is homogeneous in the sense that the inhabitants in those areas are basically pastoralists. So the main thing of the project is what we are trying to do is to operationalize One Health at the grassroots level. I know there are a lot of write-ups, there are a lot of information about One Health, but operationalizing, especially at the grassroots level, is something that has not picked up so well. And that is what we are trying to do. And how do we do this? We have three main components, and that's why the community engagement for us is very, very key. We have the coordination at the county, then we have the service delivery. That is the main thing. We are trying to introduce a new service delivery model that actually integrate the three components of health. That is a human, animal, environmental health. And in human and animal health, actually, we are doing both preventive and curative kind of services to the people and to the animals. And how do we do this? We really need to engage the community. And actually, what has really worked for us very well, I like very much what Geoffrey said. One of the things is use of known people or visuals, and this actually worked. What we actually been riding on is the existing kind of structure, and community actually are aware, but sometimes they just need to be given some bit of information so that they understand. Actually, this has come, as you can see, and I think some of them Noni has really alluded to. One of the things that I've seen that really can build trust, also can support the community, is the information. Sometimes they cannot actually just relate, but they have the information with them. So you really need to provide some balanced kind of and objective information that the community need to know and actually act upon. For instance, we talk about climate change. The community is only that the way we put it or what we try to describe, sometimes they don't understand. But the community actually will always tell you that, like for instance, if you go to northern Kenya, for instance, they've been really having a droughts, which is more frequent than before. So they will tell you, in this area, we used to have like this drought, like every 10 years or something like that. But of late, it comes like every year or every 2 years. So that's when you tell you what we are talking about. This is what we call climate change. And with that, actually, they are able to relate what they do. So what I'm trying to say that try to be as much as contextual as possible. Or if you are trying to bring something, then we really need to, get to understand the community and get to know what they do and try to relate whatever you are bringing into what they actually know that they do every day. And I think that one also will make the community, will help to build the community trust, engaging them and bringing things to their context, understanding what exactly what they can relate to their daily life. Then the other thing, I think also consulting the community. Sometimes we move in with the tailor-made kind of interventions or things like that community doesn't really understand. But if you consult with the communities, which I think other speakers have mentioned, co-creation, you work with the community from the beginning, and any other issues that has to be addressed has to start from within the community. Actually, what has worked for us also is the bottom-up approach. It is the community initiative. Even the services that we try to provide, we've made what we call, we've formed some group within the community from just within the structure, what we call multi-stakeholder innovation platform. This is a platform that basically brings together different people within the community, from the youth, the women, of course, gender issue also we account a lot. We have the health workers, the vet, the education, so the chief, the local leaders, that is, then the religious leaders as well. So these people, they have to sit on a regular basis. They discuss issues on One Health and climate change. And you see, they are able to prioritize, identify their own problem. They are able to prioritize and act on some of them that they are able to do within their reach, just within the community themselves. But for the issues that they are not able to, that's when now they will actually look for an external help. But the key thing here, let the community consult themselves and they are able to identify their own problem. You don't point to them that this is your need. Sometimes what we go with, sometimes we have in our mind that we think this community, need this 1, 2, 3 things. But actually, if you engage them, whatever sometimes they tell you is totally different from what you perceive to be their problem. So sometimes what actually have worked, I see, is the consulting the community. And the other thing also, involving them from the beginning to the end, from the design, the implementation, and all that kind of thing. So that also builds this kind of ownership. I know we've been having this project, and sometimes we had a break like almost 6 months. And we also do actually collect meteorological data. And we know for this, you find their weather stations, for instance, by the Kenya Meteorological Department, which are automatic, and they send the signals and they send the thing to the KMD, and the community are not able to get this data. But we have engaged this community in collecting this meteorological data, that is rainfall and temperature, for instance, and we do analyze this with them, and we develop some advisory and we give them back to the community. So they saw the need, they see this instrument are there, and they know what they actually do, being that they have been engaged and involved. But even past the project, when the project had a break for 6 months, they continue to do that by them through this MSIP. They could still, collect the same data, do whatever we've been doing to them and with them, and they can relate that if it rains this millimeter of rainfall, this is what this is what will happen, and these are some of the actions that we really need to do. So this is something that the community has adapted and continue with. Just because first is the information that they were given before, then secondly is consulting them whenever we want to do something, and also involving them actually participation. They have to participate in each and everything that you bring to them. So to me, I think those are some of the things that actually we have seen working for us. And I know even past, there is a long-term kind of a project, yes, but we are looking at the end of it, the community owning this and adapting and getting this. But the key thing here is the consultation and the engagement and co-creation from the beginning. So that's what I could add to that. Thank you.
Thank you very much. So I think you picked up also on what Birgit was saying is how to work with the resources that the community has already, strengthening that resources that they have and how to better use that. And I think the other really important thing, and also for myself as a scientist, is the translating of very technical terms, which I understand, into something that is relatable to the average person in which I am engaging, whom I desire that they are changing their behavior. But how do I take a very technical term and translate that to something that they can relate to? So I really like those points as well. I'm going to hand over to Martin. Martin, from VSF Germany, you work a lot with communities, and so trust is also a really important part or aspect of your organization's work, especially also in challenged areas. So, can you say a little bit about trust and how does your organization come in? Also, because you work on from the animal health sector is your entry point. Could you share a bit?
Okay, thank you, Asni. Greetings to all colleagues, wherever you are. I work for VSF Germany at the regional office here as the regional head of programs. And we work with predominantly agropastoralists in 6 countries in the Horn of Africa. And the work we do is service-oriented, and it entails a lot of community engagements. And trust is a key virtue when you are handling communities or when you are engaging with them. I have heard terms here. Some people are saying you build trust. We have just heard from another colleague that you cultivate trust. For us, we say you nurture trust. And from our experience, what we have noted over time is that nurturing trust with communities is actually an art and a discipline. It is not something that just happens spontaneously. It is something that is an outcome of, consistent, systematic, and structured engagements that sometimes take several weeks or even months. And to work with the communities effectively, you must secure their trust with what you do. And there are a number of course, our interventions cut across very many different thematic areas. But what we have learned over time is that to secure communities' trust, you must be in a position to, number one, communicate with a lot of clarity and very precisely and in a simple way about the intentions that you have. And sometimes not just your intentions, even your limitations. Be very clear about what you want to do with them, how you want to engage them, but also clarify very well beforehand the things that you will not be able to do, so that at the very onset, they are also very clear with your limitations. Listening to them in a very active way, giving them the opportunity to voice their concerns, to voice their needs, and ensuring that the feedback they give you or the expressions of interest that they have tabled also are incorporated or fed back to them in a manner that shows respect. Of course, transparency and honesty is very key in terms of even how you process the decisions when you are engaging with them, and even admitting mistakes. Because when you are engaging with communities, sometimes you have planned to do things that sometimes, because of unforeseen circumstances, don't go right. We always have an approach that if something has gone wrong, genuinely admit, genuinely explain why, so that communities can understand and appreciate that you did face a challenge and you cannot honor certain things. I think being consistent is also one key approach that we value. Being able to do what you say and on time without having to cause them surprises. I think being reliable breeds a bit of some confidence. The other thing is that trust grows when people feel, especially in the projects that we implement, that they are not merely participants, but somehow they are partners in the implementation arrangements. One thing that also worked for us very well, and especially under this ORECA project, when we did the Machakos vaccination campaigns, is the use of a local champion who is a native, who is professionally respected, and who is trusted. In this case, some of you may know Dr. Ezra Saitoti, who has now been named as a Global Alliance for Rabies Control vaccination champion. Now, this is a community member who is a professional who is respected. And if he is the one being fronted to drive a campaign, for example, against rabies, then his community trusts him, his community believes in him and respects him, and they embrace him and what he does. And that helps to nurture the trust that we talk about. Now, communities also build, or you can nurture trust with them very quickly if your interventions can demonstrate some early tangible results that they can associate with or they can relate to. You know, communities, especially personal communities, believe in what they see, not much of what they hear. And so if it is an intervention to address a particular need, they want to see quick impacts, quick results that they can associate with that addresses their most immediate needs and that assures them that your interventions are actually well-intended, community-centered, and are impactful. That has been an approach that we also build on. Now, briefly, if I may just touch on what can break down trust. I think trust breaks down very quickly when communities feel that your approach is possibly just being too extractive in terms of mining data, mining information. You are being exploitative and you are being disruptive. Disruptive in the sense that when you're working with the community, sometimes you have to be sensitive about their seasonal calendar of certain social and economic events. For example, if you have planned engagements around the time when communities are actively planting during the rainy season, they start to think that your actions are disrupting their life and they start not to be very confident about engaging with you. So being aware and appreciating the community norms, their social and cultural calendar of events, and respecting their lived experiences and knowledge is another good way of nurturing this trust. Now, trust can also be broken if, for example, you have overpromised. You come to communities, you are engaging about certain interventions, and you are overpromising beyond what you can actually realistically deliver. And if not overpromising, then sometimes you have just a good plan, but you are not able to deliver on time. You are late and you are never explaining until they start to become wary, they start to become anxious, and start to question whether they can trust that you can deliver with them. Besides that, if they have a feeling that you are holding information, withholding information, you are not transparent, I think that breeds suspicion, and the communities are very quick in sensing if you are holding some information or if you are hiding some intentions, then clearly they'll not trust you. Then, of course, being respectful of their voices. If you ignore their voices or if you undervalue their lived experiences, then clearly the relationships will fracture. And the last one, from my point of view on how we approach it, is that you have to be consistent on how you are engaging. You have to do your mapping and identify the most important stakeholder groups without excluding some groups that could be potentially marginalized, and maintain a consistent approach in engaging so that they are very clear that you are not favoring certain privileged groups or you are not discriminating against certain underprivileged groups, and that your approach is all-inclusive and the voices of every potential beneficiary group can be heard and their feedback can be incorporated. Over to you.
Thank you very much, Martin. I think I heard words like honesty and transparency and importantly, not just your intentions, but the limitations of what this engagement means. So I've taken that down and I think I've heard over from every single speaker so far, the local champions and the importance of that. So Jess, I want to come to you now. I know you've been working a lot, Nani, Martin and Odiambo has been working, in the East African context largely. You've been working a lot in Asia, and I wanted, yes, we're still all human beings, but culture is an important part of how we engage. And I wanted to get your perspectives on that, and also how do you bring that in a different culture with trust and communication. So over to you, Jess.
Thanks, Ashley. I do have to apologize. I have an awful cold, so my voice is really poor today. Um, so yeah, I'm a researcher at the University of Edinburgh in the UK, and I was formerly at the University of Leeds. And whilst in that position, we set up a research network called Community Engagement for Antimicrobial Resistance. And we have a number of large funded projects looking at antimicrobial resistance, predominantly in Southeast Asia, predominantly from a behaviour change perspective, but across One Health. And I think one thing that really jumped out to me was Noni mentioned the word time in terms of building trust. And I think that gets overlooked so much, especially in the research space, partly because you're up against funding deadlines and we're not magicians. We can't do anything about that. But you can't rush the development of trust and you can't make assumptions. So even though a lot of the work I've done has been based in similar community settings, so they're communities I've got to know, the research team and research partners have got to know them very well. We're very conscious that if we're doing a new project with a new intervention, or we're seeking to engage in a different way, or we're looking at a slightly different part of the problem of AMR, that we go back to square one in terms of not making assumptions and really leading by example with that. So our methodologies at the start of a project might include something like community mapping. So literally sitting with people and asking them, where do they buy their antimicrobials? Can you put it on a map? Can you walk us there? Why do you go here? And having the very open discussions that, yes, you can probably churn out a research paper on this. Yes, you can get an output, but that's not actually the point. The point is to sit with people as individuals and understand what they're doing, why, how, who is doing it more than other people. Oh, who are we missing from this room? We seem to be very biased towards certain groups of people. So it picks up a lot of the intersectionality issues as well, but it puts you as a researcher at the bottom of the ladder. You're going in saying, I know nothing and you know everything. And I am trusting you to give me reliable information. So you're flipping the switch there. And I think, again, and it's been alluded to, I think, in all the other speakers have talked about community champions or local facilitators, or thinking really carefully about who you put in that room. But I do think as a foreign researcher, sometimes it does help to be in that room as being visibly somebody who is not an expert and knows they're not an expert. And so you're starting that trust and engagement process from the bottom by making yourself and your research team appear vulnerable.
Thank you very much, Jess. I like the point you talked about is time. And very often as scientists, when we have a project, we are so pressed by time and also the need to deliver to the donors, whatever reporting that we, budget burn rates and all of that. And I wanted to come back and ask you the question, starting with you, Jess, is how do we meaningfully measure the impact of community engagement beyond just counting participation numbers in our training reports? So I know it's a very cheeky and difficult question, but I mean, we will have to report for a record. This is we think it's important to report it, but how do we do it that's beyond 50 people came to my training?
Yeah, I love this question. I think this is my favorite question to answer. And I think from my perspective, the answer is we just have to stop obsessing about counting things and putting numbers on things, because there are some things that you can't count but are still meaningful. And there's a lot of things that are not necessarily meaningful that you can count. And I think we get stuck in that paradigm of, 50 people sat in our intervention. Well, were they sat listening? Were they participating? Were they actually just having a rest away from the kids? What was the actual engagement? Now, that all sounds great. The reality of actually figuring out what to measure in terms of success is much more difficult. I think from my experience, making sure that you as a researcher might have certain things you have to report back on, but can you co-create a measure of success that appeals to a broad range of stakeholders in the project? I'm not going to say appeals to everyone because I think that's impossible, but can you get a consensus on what success looks like? I think that's the first step. And then thinking about what you measure. Some quite popular options, I guess, particularly in antimicrobial resistance, are looking at knowledge change. And I'm saying change and not gain, because the assumption is then that your wonderful intervention is going to give people knowledge, and it might not. So knowledge change, I think, is one thing that is becoming quite popular to measure. But as I think it was Jeffrey's presentation really clearly pointed out, just giving knowledge that's not the same as behavior change. It might be a precursor and it might be important, but that's not the only side of the story. But it's quite measurable. It's quite quantifiable. A funder or a policymaker might quite like that. The other thing you can look at with a measure such as knowledge gain is who's gaining more proportionately. So you can start to have questions around, is this intervention more appropriate for a women's group, or is it actually more appealing to this particular cultural context? Is it actually working more when we're talking about antimicrobial use in a farming context rather than in a childcare context? So you can start to bring out more meaning from your research. The other, I think the gold standard for any community engagement intervention is to measure behavior change. I don't think many of us are doing that. I think we want to. A lot of us are constrained by the time we've got to actually measure a change. If a project lasts 3 years, you spent a year setting it up, a year implementing, you've had a disaster like a pandemic or another disease outbreak or a weather event that's delayed you, and then you're getting your data in, you're probably not going to see behavior change. What you might see is knowledge change, attitudinal change, changes in behavioral intention, which are really important, but they are not a sustained change in behavior. And I think we as researchers, it is our responsibility to make sure that we're really communicating what we have measured, and is it really behavior change? A lot of the time it isn't. And that doesn't mean it's worthless. It's a precursor to behavior change, but can we be really honest about our limitations? And I don't want to monopolize this question, but I think the other thing to be super careful of is in a community engagement intervention where you're valuing everyone's input, you are asking people directly about what they think they have changed. So you're gaining information on self-reported knowledge, attitudinal practice, behavioral intentions. It's self-reported change. You can sort of get around that a bit with knowledge if you're giving people quizzes and questionnaires, but that can also just be really boring and people might not want to do it. So the limitation there is what you're measuring is a self-reported change. Some people will be very invested in your intervention. Some people will be telling you what you want to hear. Some people won't be. And again, as researchers, all we can do is deal with the information in front of us and present that honestly. And yes, reviewer two in a manuscript might not like the fact that you've done self-reported knowledge change measurements. But if you felt that was most appropriate, and that's what appealed to your stakeholders and your communities, I think it's important to justify that and stand by what you've done, that you've measured what was meaningful to your team and your community in that moment, and this is what you've learned from it, and recognizing we probably still have further to go in terms of how do we measure sustained behavior change and how do we secure funding that allows us to continue to do that and keep a community meaningfully engaged long enough to do it in an equitable way. Sorry, I think I've waffled a bit.
No worries, Jess. I think you're getting, or at least the way I understand it is that, and what I take away is that what does, defining exactly what the success looks like at the onset of the project. And that is always very difficult. You just got the grant, you're about to kick off, and you're already thinking about the end, which is such, as somebody who manages grants and have my own grants, it can sometimes be so daunting to think about it. But I think the words that resonate with me is that end in mind, and how to define that, and also to be brave. I think a lot of the times it's difficult to be brave when we're not following a certain path, and how to be more brave about that. I think what you said, in terms of knowledge change, I think one of the challenges is how do you measure that? And it's quite clear having just a microbiologist in a room is not the best thing. And definitely, I think, again, coming back to the theme of One Health, we need to have more people in the room with different expertise, different knowledge, different entry points to help us to define and also to help each other understand as we are moving through a process. And I think it's a process that never ends. So I really like the response. I want to get another response from Martin about a similar thing. I mean, you're an NGO providing extension services. You also have donors. You also have reporting to do, and so how do you, I know we have to have numbers, but how do you kind of balance this numbers game? Or maybe you don't.
Yeah, thank you. Thank you. I think the question is about how to measure change and how to balance these numbers with the donor expectations. But ideally, measuring the impact of community engagement beyond just the head counts for us means capturing depth, capturing quality, and the transformation that takes place, not just the attendance, which you report as gender disaggregated, how many male and women and female and the youth that attended various meetings. And qualitative metrics such as trust levels and community decision-making autonomy, or even the policy influences that have occurred, can be used as indicators to measure, the success or the positive outcome of these community engagements. Now, we do look, for example, at things like where power dynamics in the community shifted. If at the baseline, probably a finding was that predominantly men control decisions, control resources, control access to services. And so after several years of engagements, how do you measure if there has been a success? So assessing whether communities gained more control across the different gender dimensions, in terms of even leadership, in terms of even decision-making authority over time, can be a good indicator. And of course, behavioral indicators as well. Apart from just numbers of attendance of meetings and things like that, we also look at tangible changes that have occurred. If, for example, the behavioral change and community engagement was about uptake or access to services, then you want to check if uptake of services increased or adoption of some new practices that you are promoting improved, or if community by themselves have certain community-led initiatives that are tangible and you can relate to. Of course, beneficiary voices as well. People who have been engaged over time, you could go back to collect narratives from community members to see how the engagement has impacted or affected their lives, relationships, or even the sense of agency. And of course, longevity or repeated engagements with same communities. If, for example, you have made interventions where engagements did take place, if you came back another time and you still can attract the same audience or more or less audience of the same characteristics, then you can be sure that there is some positive impact in terms of participation. It's a good signal of meaningful connections. Then, of course, you can also assess in terms of capacity building if there is a considerable growth in community leadership, not only in leadership, but also skills, organizational strengths, and such kind of things. Over to you.
Thank you very much, Martin. We are coming to the end, but I have one question, and I think it's a slightly provocative question that I want to ask all of you, and you'll have 1 minute just to answer me back, as I think this is a conversation that we could have had in person for days on end talking about it. But my one question is community engagement always ethical? And thinking of it from a risk of tokenism, and also when we extract information, but we don't give anything back. For the project extracts but doesn't give back. So 1 minute, Noni, you're on.
No, it's not always ethical. And what you've just said is correct in that oftentimes we forget and lose ourselves and think very inwardly, think about us and what we want to gain from our community members, what we want to extract, as you've put it. So it takes a very deliberate effort for our researchers and other people who are doing community engagement to very carefully think about what are some of the ethical issues that could arise out of the engagement, and how then can we mitigate against those ethical issues are coming up. There are very simple things such as what Birgit brought out in terms on the chat, in terms of, for example, just simple things like making people wait for you for long times, having an engagement meeting and not catering for people's needs, for example, meals, water, just as an example, calling a community meeting and there's no water to give people, there's no place for people to sit. Some of the things that you've said, you conduct research activities, you don't go back to give feedback to those communities, and the list can be endless. There's also ethical issues around whether people participate in engagement activities and then feel that it is a must for them to agree to what you're doing. For us in research, for example, you do an engagement activity and people feel like now we must participate in this research because they come to talk to us about it. So very carefully wording yourself so that people know that it's voluntary, and even though you've called them into a meeting, it's not a must for them to participate. It's a very voluntary activity.
Thank you very much. Adiamo?
Yes, thank you very much. And actually, I would agree with Noni that the community engagement is not always very ethical. I think it depends on what actually your focus is, and how the community resonate with the intervention or whatever you are trying to do. Because if it is something that the community perceive that it is theirs own, or if the community are able to identify it by themselves as this is an issue, then I think the engagement will be more of a personal to the community themselves. And I think what I think that also is maybe you may have to focus on is like you have the community kind of a community dialogue. And in this, actually, when you have the community dialogue before another thing, they will be able to talk freely, to share freely, identify whatever they have. And with this, together with the period of engagement, it doesn't have to be like a one-time, one-off thing, then you go away. But at least the more you continue engaging the community and they are able to see the effect or relate to their daily life, they relate whatever you are trying to bring forth with them, what they do and how it affects them, and they also see the positive part of it, then that will take another different dimension. However, if you go like with everything as per your own perception and you want them to do it your way, not their way, or not the way they think it will really, support on what they see as the problem, then again, that one will be a different case altogether. Yeah.
Thank you very much. Jess?
Yeah, so I should say, by definition, community engagement should always be ethical if you're genuinely engaging your community. However, I think what often happens is engagement is a spectrum, and when people are not engaged well or appropriately or through mechanisms of trust, it becomes unethical because you're either extracting data or imparting useless knowledge that people do not want or need or understand why you want them to want it. So I think it's the engagement with engagement that's the issue here. And I think there's there's a lot of pressure around that. And I think it can sometimes relate to time pressures and funding pressures and your donor or policymaker expectations as well. So I'd extend it not just to community engagement, but stakeholder engagement. And I think it just loops back to the conversation about trust that we had at the start, that community engagement done well, slowly, built on a foundation of trust and co-creation should be ethical. But if that is not planned into the project or the intervention or whatever it is you're doing, you then risk really big ethical pitfalls that can be extremely harmful.
Thank you very much, Jess, for that. And Martin, last words from you? Martin?
Sorry, okay. I think I can associate myself with the comments of the colleagues that community engagement is not inherently ethical. Actually, engagements can indeed become sometimes very extractive and only serves the purpose of, for example, the intervening partners or organizations. Ethical engagement requires that there should be actually feedback. There should be, for example, some level of compensation and reward for the level of effort and time of the communities that you're engaging with, and also transparency. So I think that there are certain risks that whenever you do a community engagement, some ethical pitfalls can occur. And for example, overburdening of communities without providing the necessary support, or even ignoring power dynamics. For example, when engagement does not account for the historical, social, and economic inequalities that exist. And of course, sometimes, as I said earlier, doing harm, that you plan to engage without respect to the social calendar of events and activities, and you disrupt their normal way of life. How does an ethical engagement look like, if you ask me? I think first there should be some mutual benefit, that communities also feel that they can gain something meaningful. This can be in form of either skills or can be in terms of resources or influence or improved outcomes. But above all, as is always the case with this kind of engagements, there should be informed consent and clarity about the objectives, about the goals and the limitations, and let communities opt, with full knowledge and understanding if they want to engage or not. Then, of course, share the decision making that go beyond consultation, that they are involved, as we have discussed many times here today, the co-design, they become co-leads in the interventions, and they also co-own the process and outcomes. And finally, of course, nurturing the ongoing relationships, that the engagement should, in an ethical point of view, is not just a one-time off event, but should be sustained in a mutually respectful way going forward. Over to you.
Thank you very much. So we've reached the end of today, and I want to say thank you very much for all the reflections and also the communication that went on in the chat. I would ask if it's okay that everybody turns on their camera so we can take a photo as a memory of our conversation today. Quickly, if you can, turn on your camera. Geoffrey, will you help to take some pictures as well as screenshots? You can smile and wave as we wait for people's cameras to slowly come on. Thank you very much for being kind to put them all. I see big smiles. I like that. Oh, yes, I got a picture. Geoffrey, you're taking pictures as well, right?
Yeah.
Thank you. One more big smile. Thank you all very much. So again, thank you so much. I had 15 questions that were planned for today, and we only made it to 3 of the questions. And I think I think still we had good conversations, kind of questioning the ethics of our engagement, how best can we do it? And there were so many words that came up, which I hope we will get a chance to reflect on a word cloud. And if you follow me on LinkedIn, I don't mean to advertise, I'll try to put some reflections from today there. But I think the conversation doesn't end here. As you would have seen in the chat, Geoffrey has put that we have one more, the next webinar will be on the 27th, October 27th, talking about One Health capacity building. That will be led by my colleague, Leon. So please join us there. But for the rest, thank you. Have a wonderful day. And thank you for being a part of this dialogue. Take care. Bye-bye.